Hi everyone, so Dr. Chad McGee and this is Angel, and today we're going to talk about Cushing's. Cushing's it's a disease that horses get. It typically sets in older age. It's caused by a tumor that they get on their pituitary gland. And it's not a tumor in the sense that you have to worry about it, that ultimately being the demise of the horse. But what it causes is for the pituitary not to function normally. So normally the pituitary gland makes hormone. That hormone goes downstream, has its effects, and without getting too in depth here, ultimately it makes enough product and then that feeds back to the pituitary gland, and the pituitary recognizes that, all right, we've made enough of the product and we can stop production. In horses that have this disease, that doesn't occur, so it continues to make excess hormone here. One of the hormones that's made is cortisol, which it's the body's own steroid. It helps it suppresses the immune system. So some of the things that you can see with horses that have Cushing's, they can have chronic recurrent foot abscesses, chronic recurrent sinusitis, or infections in their sinuses. A number of things that just really a normal horse's immune system would kick and wouldn't have an issue with. However, in horses that have Cushing's, this winds up being a problem just because their immune system isn't really up to snuff. So that's one of the things that you can see. The other things that you can see from it, typically they have a bit longer hair coat. They don't shed out quite the way that they should. So the other thing is abnormal fat distribution. So Angel's about 23 years old, and typically in a horse that age you would expect up in there above their eye, typically you expect that area to be concave or kind of sunken in. And with Angel, you can see he's got these big supraorbital fat pads. Additionally, you can also see that he's a bit on the thinner side, but despite being on the thin side, he still has this, he still has this big cresty neck on him. So again, abnormal fat distribution is one of the things that we can see with Cushing's. So if you're seeing any of these things in your horse, give your veterinarian a call, have them test your horse. I'm on the side, I would much rather be proactive than reactive on the side with Cushing's, because the biggest thing that you worry about with Cushing's is them developing laminitis or foundering. If you can catch a horse before you wind up running into that and prevent that from occurring, fantastic. So again, hopefully we answered some questions here for you today, and thanks for watching. Take care.